efforts from his administration in response to the fast spread of COVID. Let's listen to President Biden.
But before I begin, I know there's a concern and some considerable confusion about the rising cases. So let me provide a quick update and talk about 3 specific topics. And I'll give it to you straight, as I promised you I always would. We're going to see, as you all have been hearing, continued rise in cases. Omicron is very transmissible variant, but much different than anything we've seen before. But you can protect yourself. And you should protect yourself, quite frankly. Get vaccinated. Get boosted. There's plenty of booster shots. Wear a mask while you're in public. Because what we know is this. The impact from the rising cases depends on the effect on the person based on whether that person, what their vaccination status is. You can control how big an impact Omicron is going to have on your health if you get Omicron. You know, those are fully vaccinated, especially those with the booster shots. And by the way, we have booster shots for the whole nation, okay? You can still get COVID, but it's highly unlikely, very unlikely that you become seriously ill. And we're seeing COVID-19 cases among vaccinated in workplaces across America, including here at the White House. But if you're vaccinated and boosted, you are highly protected. You know, be concerned about Omicron, but don't be alarmed. But if you're unvaccinated, you have some reason to be alarmed. Many of you will, you'll experience severe illness in many cases if you get COVID-19, if you're not vaccinated. Some will die, needlessly die. Unvaccinated are taking up hospital beds and crowding emergency rooms and intensive care units. That's displacing other people who need access to those hospitals. So please, please, please get vaccinated now. You know, we've reduced the number of American adults without any shots from 90 million to about 35 million in the past 6 months. But there's still 35 million people not vaccinated. And let me be absolutely clear. We have in hand all the vaccines we need to get every American fully vaccinated, including the booster shot. So there's no excuse for anyone being unvaccinated. This continues to be a pandemic of the unvaccinated. So we got to make more progress. And for patients who still haven't gotten your kids vaccinated, please get them vaccinated. Look out for their interest here. It's the best way to protect them. And for parents with kids too young to be vaccinated, surround your kids with people who are vaccinated. And make sure you're masking in public so you don't get COVID and give it to your kids. Look, we have no reason to think at this point that Omicron is worse for children than previous variants. We know that our kids can be safe when in school, by the way. That's why I believe schools should remain open. You know, they have what they need. Because of the American Rescue Plan, well, the first month we were in office, or second month, that I signed in March, we provided the states with $130 billion, with a B, billion dollars to specifically keep our students safe and schools open. Funding for ventilation systems in the schools, social distancing in classrooms, even larger classrooms, on buses and everything from bus drivers to buses, the actual bus. There are additional, in all this process, we also back then included an additional $10 billion for testing for schools. That money went out to the states, and the states and the school districts have spent this money well, many of them, but unfortunately, some haven't. So I encourage the states and school districts to use the funding that you still have to protect your children and keep the schools open. Countries across the world are seeing rising cases. Here in the United States, our team have been working around the clock during the holiday weeks. In the last 2 weeks, we have developed hundreds of military, we have deployed, I should say, hundreds of military doctors and nurses to staff the hospitals in our states that are overrun and overworked because of unvaccinated COVID-19 patients primarily. The Federal Emergency Management Agency, FEMA, is also working at our direction in every state on hospital capacity, including whether they need beds. I've directed FEMA to be ready to provide emergency hospital beds wherever and whenever they're needed. The federal government will be there. We've shipped nearly 2.4 million pieces of protective equipment to hospitals, from gowns to gloves. And we're doing whatever we can to protect communities from the surge of hospital cases that are likely to see from the unvaccinated population. Look, now let me address 3 specific updates before I get my full brief from my team. First, booster shots. I know, Dr. Fauci, I'm like an echo chamber here, okay? I know it. But repeating myself, but Dr. Fauci said it very clearly. Booster shots work. They significantly increase the protection. They provide the highest level of protection against Omicron. Americans, we've given out over 70 million booster shots. Importantly, 2 out of 3 eligible seniors have received their booster shots. Booster shots are free, they're safe, and available at over 90,000 vaccination sites. Let me say that again. They're free, available, and at over 90,000 sites. We have added sites, added hours, added appointments, added walk-in capacity. We have booster shots for every American in the country. It's easier than ever to get a booster shot, and more importantly than ever has been. Look, the FDA has also now authorized booster shots for children ages 12 to 15. So, with the final approval from the Center for Disease Control and Prevention, the CDC, young people, when that occurs, young people ages 12 to 15 will be able to get booster shots later this week. Second, on testing. I know this remains frustrating. Believe me, it's frustrating to me. But we're making improvements. In the last 2 weeks, we've stood up federal testing sites all over the country. We're adding more each and every day. Google, quote, COVID test near me. Go there, COVID test near me on Google to find the nearest site where you can get a test most often and free. Look, with more capacity for in-person tests, we should see waiting lines shortened and more appointments freed up. Look, if you want to test yourself at home, we have 3 options now. 1, drugstores and online websites are restocking. 2, so the more tests are available, we're going to continue to become available. Next week, our requirement that your insurance company reimburse you for at-home tests takes effect, so you don't have to get reimbursed. So if you're insured, you can buy the test and get paid for it. The second thing I want to mention is many states and local governments and healthcare providers are passing out free at-home tests that you can pick up. Just find out where they are. And finally, as I announced recently, the federal government is launching a website this month where you can get tests shipped to your home for free upon your request. The third point I'd like to speak about is on treatments. For those at high risk who do get COVID-19, we now have a new Pfizer pill that greatly reduces the risk of hospitalization and death. I'm pleased to say that on Christmas Eve, we shipped out the first batch of these pills that we purchased and received. And more will be shipped this week. They're already saving lives, but due to complex chemistry of the pills to make the pill, it takes months literally to make a pill. But production is in full swing. The United States has more pills than any other country in the world, and our supply is going to ramp up over the coming months as more of these pills are manufactured. Today, I'm directing my team to work with Pfizer to double our order from 10 million to 20 million treatment courses to be delivered in the months ahead. We may need even more. That's the estimate we need right now. We've already placed the largest order in the world. Now I'm doubling that order. These pills are going to dramatically decrease hospitalizations and deaths from COVID-19. They're a game changer and have the potential to dramatically alter the impact of COVID-19, the impact it's had on this country and our people. Look, let me conclude with a quick recap. If you are vaccinated and boosted, you may get COVID, but you are highly protected against severe illness. Schools can and should be open this winter. We have all the tools to keep kids safe. Unvaccinated kids are at risk, yet the vaccinated are going to have a way to protect them. Get vaccinated. If you're vaccinated, get boosted. Folks, I know we're all tired and frustrated about the pandemic. These coming weeks are going to be challenging. Please wear your mask in public to protect yourself and others. We're going to get through this. We're going to get through it together. We have the tools to protect people from severe illness due to Omicron if people choose to use the tools. We have the medicines coming along that can save so many lives and dramatically reduce the impact that COVID has had on our country. There's a lot of reason to be hopeful in 2020. But for God's sake, please take advantage of what's available. Please. You're going to save lives, maybe yours, maybe your child's. Please take advantage of what we already have, okay? So thank you. Now I'm going to get this briefing started. Thank you very much.
President Biden there jumping into his COVID briefing after warning the nation that in the coming weeks, COVID cases will increase, and he's using that as an opportunity to encourage people to get vaccinated, saying that children between 12 to 15 can get booster shots soon. Also noting that the federal government is increasing testing sites across the country. And the headline, though, being that the administration is already distributing a new treatment, a Pfizer pill to tackle the still expanding pandemic. Let's bring in Chief White House correspondent Nancy Cordes, who's also been listening into this. The administration certainly under pressure. What should we make of some of the things the president just said, Nancy?
No question, Errol. He wants to show that he is tackling this pandemic aggressively, announcing that instead of ordering 10 million doses of that Pfizer antiviral pill, that the administration will now order 20 million doses. And it comes amidst a wave of criticism that the federal government didn't move aggressively enough to order rapid tests for the entire country. And the president acknowledged that there have been widespread shortages. He assured the public that stores would begin to restock their shelves, but that's cold comfort for the now more than 1 million people a day who are either coming down with COVID symptoms or testing positive.
We want to bring in CBS News medical contributor Dr. David Agus as well, also listening in to the president's announcements there. What do you make of the purchase? 20 million Pfizer COVID treatment pills. I understand they're called Paxlovid. How effective is this?
So Paxlovid, it's 6 pills a day for 5 days, and it's 20 million treatment courses. It is a remarkably effective pill that as an outpatient at home you can take and 90% block hospitalization in high-risk people. That is a dramatic thing we need to fight this virus. The problem is they are in remarkably short supply now. It is a drop in the bucket to 1 million cases, the numbers of treatment courses we have at the present time. And it's critical to decide who gets those treatment courses is going to be really hard over the next couple months.
All right, Dr. David Agus, our thanks to you and Nancy Cordes at the White House. Our coverage will continue on our streaming network, CBSN, Your Local News, and of course tonight on the CBS Evening News with Nora O'Donnell. This has been a CBS News special report. I'm Errol Barnett in Washington.
For news 24 hours a day, go to cbsnews.com.
You've been watching a CBS News special report. President Biden and the White House COVID-19 response team are discussing the country's fight against the pandemic. The president announced a new commitment to buy and distribute Pfizer's coronavirus treatment pills. He also stressed the importance of masks, vaccinations, and boosters. Mr. Biden says the U.S. should be concerned about Omicron, but not alarmed if you are vaccinated. He added, "We have the tools to fight it." For more on this, I want to bring in Dr. Jerry Abraham. He is the director of vaccine programs at Kedron Health. Dr. Abraham, the Biden administration is now buying 20 million treatment courses of Pfizer's COVID pill. They started shipping them out. However, they won't be available immediately. We're seeing a massive surge in cases, as we all know, right now. What is your reaction to the administration's plan and timeline for these pills?
Yeah, thank you so much for having me again. We're clearly in the thick of testing and vaccines, and now we really do want to race to get these treatments out to people. But we were in that first batch that was ordered, and we still haven't received it, and we don't know if it's lost in shipping or with FedEx or UPS, but we know that we're waiting for those pills, and we have people coming every day asking for those pills. But like the other guests mentioned, I mean, it's impossible to find right now. So we're a long way off from having enough treatments for everybody who needs it. And those really are people that are vulnerable or could really get seriously sick from COVID-19. They need that treatment now.
Yeah, those pills can't get here quickly enough. The CDC guidelines on isolating if you test positive for COVID-19 have changed recently from 10 days to 5. The CDC may soon announce a new testing component to that. Do you think the testing component is necessary, and should it have been part of the process from the beginning?
I really think we're in this fork in the road. Which direction are we going to go? Back to the older days of more time for isolation and quarantine. Those were those 7 days, 10 days, even some doing 14 days, to now this 5 days and no test to go back. But we're balancing that with needing to get back to work, back to school. Our hospitals need to be staffed. Our clinics need to be staffed. So some of these very rigid isolation and quarantine requirements were making it very difficult for us to be able to do what we need to do in healthcare. So it's a very challenging thing, because I don't want to bring someone back to work, back to a vaccine or testing center who still is contagious. And so I think having a second test is helpful. However, it's next to impossible to get a test right now.
On that note, we heard the president say a website is launching this month to order at-home testing. How necessary is it that tests become available at a quicker pace and in a bigger quantity? No one can get a test.
Yeah, so we were really excited to see that yesterday the Los Angeles County Department of Public Health went ahead and put out a website and a link, and you can order a test that would be delivered to your home. And it's actually PCR, so you could actually put the sample right back in with the shipping label and get your results. And that's awesome. I know that the federal government is looking at how to get these free tests to people. And as a community health center, we've already placed several large orders, but again, we haven't received those tests. Behind me are actually tests that I use out on the road when I'm vaccinating and testing, but it is impossible to get. And I'm worried when I'm done with these boxes of tests, I don't have any more. So we really need to get more tests out onto the market as quick as possible, because people need that negative test to go back to work, back to school, and to travel.
And we need people working. We need kids in school. I want to talk about boosters. There's also some change there. The CDC backed the FDA in shortening the time between your second dose and booster to 5 months instead of 6. The CDC is also expected to follow the FDA in authorizing boosters for children aged 12 to 15 and immunocompromised kids 5 and older. How important do you think those changes are?
Well, I really think we've moved away from this notion that boosters are a luxury or a choice. They really are a necessity, and they are essential. And as President Biden just mentioned, remember, vaccines are safe, effective, free, and now they're available to everyone. There's no reason not to get your first and second dose, but also now there's no reason not to get your third and your booster. And I'm glad that 12 and over are now eligible. Those with medical conditions need their third shot ASAP, because even though Omicron may be milder, it is clearly more contagious. And when vulnerable and older folks get Omicron, they're going to have a tough time. So we're really going to want to make sure that everyone is as protected. Boosters are not a luxury. They're a necessity right now.
So, Dr. Abraham, does this mean there's a new definition for being fully vaccinated?
I think that's really where we are, is that you really need 3 shots to be ultimately protected, looking at the data that we have now. And despite that, we're seeing people that are fully protected still catching Omicron, but clearly more mild, less severe, not requiring hospitalization, ICU admission, and not resulting in death. And so while people are frustrated that you could have gotten 3 shots and still catch COVID, that's a lot better than not having any shots and being hooked up to a ventilator in a hospital. And mind you, there are not ventilators right now to go around. So really, I urge people, don't sit and think about booster shots. Get in line and get boosted.
While all this is happening, as we all know, cases are just skyrocketing. What are you seeing in LA?
It's really, it's frustrating. Here we are a year later from when my vaccine program began, and literally I'm staring at lines around the blocks here in South LA. It's heartbreaking because these folks need to go to work. They need to go to school. They need to take care of their families. And instead, they're here waiting for hours in line for a vaccine or a test. I don't have the staff. I don't have the resources. I don't have the tests to really meet all the demand, but we're going to do the best we can. And we're collaborating and cooperating with the county and the state officials to meet this increased demand. But after the holidays, we have been slammed with people very concerned that they are positive, that they are in a race to get boosted, and we are doing everything we can to meet people where they are. But it is heart-wrenching to think 12 months later, we're right back to where we started.
It's a tough, tough time. Dr. Jerry Abraham, thank you.
Thank you so much for having me.
We're going to take a quick break. More news is next here on CBSN.
I'm Nora O'Donnell in our nation's capital. We're here at the White House with the President of the United States.
Thanks for having me. I appreciate it.
The Supreme Court building behind me is once again at the center of a monumental battle. Tonight, a